Lesch Nyhan syndrome is a condition characterized by neurological and behavioral abnormalities and the overproduction of uric acid in our bodies. Don't you think the name resembles that of a man, such as Nahyan, right? So you can think of a man and it will help you remember that this disorder is more common in men, and it will also help you remember that it's an X-linked recessive disorder. AGPRT deficiency is inherited as a recessive X-linked trait. Thus, males are generally affected and women are generally asymptomatic carriers. At least 5 women with Lesch Nyhan syndrome, due to a variety of molecular mechanisms, have been described in the literature. The prevalence of this disease is estimated to be 1 in almost 380,000 live births in Canada and 1 in 235,000 live births in Spain. So, Lesch Nyhan syndrome is an X-linked recessive disorder. What does that mean? A condition is X-linked if changed gene responsible for the condition is located on the X chromosome. The X chromosome is one of the 2 sex chromosomes. Females have 2 X chromosomes and the males have 1 X and 1 Y chromosome. Females who have 1 mutated copy of the responsible gene usually do not have the condition and are referred to as the carriers. This is because they still have a working copy of the responsible gene on their other X chromosome. Males with 1 mutated copy of the responsible gene have signs and symptoms of the condition, that is, they are affected, because they do not have another X chromosome with a working copy of the gene. This is why X-linked recessive disorders, including the Lesch Nyhan syndrome, occur much more frequently in males. The affected patients do not survive past the first or the second decade of life due to the renal failure. Lesch Nyhan syndrome is caused by mutations in the AGPRT gene. A female who is a carrier of Lesch Nyhan syndrome has a 50% chance of passing on the mutated AGPRT gene in each pregnancy. This is because a carrier female will randomly pass on one of her X chromosome to each child. Sons who inherited the mutated gene will be affected, and the daughters who inherited the mutated gene will be the carriers. This means that with each pregnancy, a female who is a carrier has a 50% chance of having an unaffected son or a daughter, a 25% chance of having an affected son, and a 25% chance of having a carrier daughter. So keeping in mind these statistics, it's quite easy to calculate how this syndrome is passed on from generation to generation. Although it is a very rare disorder, we have to look for the signs and symptoms in the patient. So in this particular lecture, I'll be outlining the clinical features and the treatment modalities that are out there for these particular patients of Lesch Nyhan syndrome.